All right. So just a quick reminder of the very most basics. I think as all of you know, Home for Good is our community's action plan to end chronic and veteran homelessness by 2016 and to ultimately create that path to ending all homelessness in our region. A couple characteristics about Home for Good. We are very much driven by data and understanding what's happening in the community and fueled by vision, collaboration, and innovation. And that's very much in partnership with all of you. We have hundreds of leaders from the nonprofit, public, private, and philanthropic sectors who have been working together over the last 3.5 years to bring this plan to life and who have embraced this vision and are implementing this work every day on the ground. And we are so proud to have such an incredible community of people working together towards this goal. So as I mentioned, this will be the first in our series of webinars. We will ultimately be having monthly webinars starting in July where we'll provide updates on what's happening on our key initiatives, respond to your questions and feedback, and really create opportunity for participation across the community. What we've realized over the last couple years is just how broad and deep this community is. There are thousands of people across Los Angeles who want to be a part of ending homelessness, and we want to create every opportunity we can for people to engage in the work, from the people doing the work in our sector as well as community members and volunteers who want to get more involved. So we will be doing this on a monthly basis just to keep you all up to speed on what's happening and to give you a chance to connect in with our work. So for today, we'll do a bit of a deeper dive into some of the background, both of the recent gap analysis that we've conducted on key data points around homelessness, as well as walking through our key initiatives for Home for Good, and then talk about opportunities to collaborate, which is something we want to do every single month, is to talk about how we can all work together on these initiatives. And finally, we'll have time for Q&A and dialogue with you and talking through our next steps. So our Q&A portion may be a little bit shorter today, just given how much background we'll be doing. But like I said, feel free to chat in throughout the call if there are things that we can clarify, questions we can answer, comments you want to make. Please feel free to do that throughout the call. All right, so with that, we will dive into some of our data. So just a brief reminder of our 2013 homeless count. This combines the 4 continuums of care. We know that overall we counted 58,000 people who were homeless across Los Angeles in the last homeless count. And what you see on the screen here is that number broken down across our 8 major service planning areas. You can find your community on this map to see how many people are homeless in your region, as well as the number of chronically homeless people and veterans in your community. So this data was gathered in January of 2013, so it was just over a year ago. What we're so excited to share is the impact that our Home for Good partners have made over the last 3 years. So Home for Good began in January of 2011, and you'll see that the number of chronically homeless people and veterans that were housed each year over the last 3 years has continued to climb. We were happy to see that from 2012 to 2013 there was that increase, even though it was modest. We know that in 2013 we were facing significant challenges with sequestration and dramatically reduced resources. So we're incredibly happy that the community was still able to house basically essentially the same level of people as they were in 2012, despite those significant challenges. So recently we conducted a gap analysis, and I'll be a little bit nerdy here for a minute and dive into some of our data. We're very grateful to Mike Nailat on our team, who's led our data analysis, and the partnership of Paul Howard as well, both from his time at CUCS and now at Community Solutions, supporting us in looking closely at these numbers to better understand not just what the need is in our community, but what are the resources we have to meet that need, and what's the gap, so that we can start to look together at how we fill that gap. So just a bit about the process we went through. So the first step was to pull that homeless count data from all 4 continuums of care. I believe the proper term is continua, but I can't bring myself to do it, so I'm going to say continuums. The next step was adding projections for people who become homeless between now and 2016. And this was an important step for us. What we realized was that our projections when we first launched the plan were a bit too moderate. We didn't realize the volume of people who become homeless each year, chronically homeless and homeless veterans who become homeless each year. We realized through this analysis that that number was much higher than we realized. So we added those projections of people who will become homeless over the next couple years. We then subtracted the number of people who were housed last calendar year since this homeless count, I'm sorry, that's a typo, subtracted the number who were housed in 2013 because we know this count was conducted in early 2013. So we subtracted the number of people who were housed from the total need. And then finally, this was a really exciting opportunity to use the VI SPDAT data, which is the data that's been gathered from surveys that have been conducted throughout the county. And the VI SPDAT is an assessment tool created by Ian DeYoung of Org Code. And for the first time, it provides us data on exactly what type of housing is the best fit for each person who's being assessed. So we'll talk more about that later, but it's basically tells us which housing option is best between permanent supportive housing, rapid rehousing, or affordable housing with short-term supports. It helps us understand the needs. Even within our chronically homeless population, there is a significant variance between those 3 housing types. When initially we had assumed every chronically homeless person needs permanent supportive housing, we're realizing that that's not necessarily true. So we had data from over 3,000 people that we then applied to this need data to understand what the housing needs were of the overall population. One caveat I'll give is the projections of the current gap, and this is a bit of a warning before we get to the next slide because these numbers can feel overwhelming. There are 2 assumptions in this data. The first is that it assumes that we will have no new resources or repurposing of existing resources. So it basically assumes that we will continue to do exactly what we've been doing, that no new resources will come into our community and we won't do anything differently. What we all know, what we know, and I know what you know on this call, is that we continue to innovate and to maximize the resources that are in our community. So we know there are significant opportunities within this where we will continue to see that gap close. The second major caveat is that these numbers do include the hidden homeless count. This year, LAHSA will be releasing figures that give us data on our homeless population without the hidden homeless. And just as a reminder, the hidden homeless count is a phone survey that's done of people who are living throughout LA County to ask them if there's anyone living in their backyard or in other places not suitable for human habitation. And traditionally, those numbers have been included in our overall homeless count. So we would like to do this analysis without those numbers because we believe that the most critical piece of our count are the people who are living on our streets and in shelters. So we will be, once we have those figures from LAHSA, as they will be releasing them in the next few months, we'll be running these numbers again to look at them without that population as well. Okay, so with that, we will jump into the data. So 2 ways that we're going to look at this. The first one is by population. So we have 3 populations here that we're looking at. Because Home for Good focuses on chronically homeless people and non-chronic veterans, we've broken down the need by those populations. So first you'll see chronically homeless non-veterans, then chronically homeless veterans, and non-chronic veterans. Those are the 3 populations. And to run you through the columns, you'll first see the need, and you'll notice those numbers are quite high. That's because this does include the projection of people who will become chronically homeless or homeless veterans over the next 2.5 years. You'll see the current resources for these populations, and then the gap, which is basically the second column subtracted from the first. We also here have an estimate of how many people are currently housed each month in each of these categories, and where we need to go as a community in terms of how many we will ultimately house each month. And this is on average over the next 30 months, taking us about halfway through 2016. So this is the breakdown for our three populations, and we know that number can feel daunting. We see that we need to triple the rate at which we're housing these three groups of people. But I do want to say again, we have incredible opportunities to continue to shift our existing resources, as well as to look at these numbers again once we have a better understanding of our hidden homeless count. And just as a sub-note that you'll see on here, these numbers do not include about 13,000 veterans that are projected to not need additional housing resources, for whom the assumption is their homelessness will self-resolve based on what we've seen. So the next slide here, you'll see this same analysis by housing type. So this is the exact same data, but just broken down by these three categories of housing. And you'll note we have less data on the latter two. We're still coming to a stronger understanding of the current rapid rehousing and affordable housing resources. But here again, you'll see the need broken down, as well as the current resources, and then the gap between the two. So as you'll see, there is still a significant gap of permanent supportive housing, but lower than we thought, given that we now know that for many chronically homeless people, rapid rehousing is a great solution for them, as well as for some affordable housing and for some of our non-chronic veterans as well. So here again, you'll see our monthly housing placement rate. You'll notice rapid rehousing is 0. This is right now mostly due to a lack of data on our part. So we know that there are certainly folks out there being housed, chronically homeless people and homeless veterans being housed through rapid rehousing programs. We will be coming to a better understanding of that over the coming months as we ask you and we ask all of our partners to share with us the work that they're doing on rapid rehousing. So we know we will see those numbers improve over time. So we wanted to highlight today one opportunity that we see as we're analyzing the data, one opportunity we see to begin to close this gap. So as we look at the permanent supportive housing in particular, what we see is that only 52% of new and turnover supportive housing is dedicated to chronically homeless people. So if we look at that as a tremendous opportunity to increase our housing stock, if we look at shifting that over time to 100% of new units coming online and turnover units being dedicated to this population, we've seen that this could add over 4,500 units of supportive housing to our community. So if we're able to do that over time, that would increase our monthly housing placements from 336 chronically homeless people per month to 486. So a significant jump in our ability to place chronically homeless people into supportive housing. And one way to do that, we'll talk more about coordinated entry, but what coordinated entry will enable us to do is for permanent supportive housing providers to identify chronically homeless people in their community for their units of housing. So it creates a much easier mechanism for targeting folks who are chronically homeless in your community. So we wanted to highlight that as one opportunity today, as we were surprised to see how low that number was, to be honest, in terms of the permanent supportive housing units that are currently dedicated to this population. And we'll be highlighting different opportunities each month around closing this gap. We're certainly very focused on the resource side as well, to work with housing authorities throughout the county to look at how they're dedicating their voucher resources, working with affordable housing developers and other sources of housing resources throughout the region. So 4 initiatives that we want to share with you today that are the focus of Home for Good. The first is around building systems. So we've talked about since the launch of Home for Good the need for a housing first system. And over the last couple years, we've been exploring the implementation of a coordinated entry system, also known as CES. So we'll share more about that. Another major focus area for us is harnessing and targeting our resources, which we do through our Home for Good Funders Collaborative, a public-private partnership of funders throughout LA County. We've also been working closely with the provider community to look at the impact on the ground. So how do we support direct service providers in achieving excellence? And that's our Standards of Excellence project. And then over the years, we also have had a significant focus on increasing public and political will through community mobilization and education. So the first initiative that we'll talk about is coordinated entry. So this is a rough sketch of what we see as the before and after. And on the left, you'll see what many case managers and direct service staff have described as the maze that they and their clients experience when they're seeking permanent housing in our communities. So it's been a complex and cumbersome system to navigate, to both find available housing in the community, to prepare all of the documents that are needed to move into housing, and to actually be able to successfully move in and have the supports that folks need to stay there. So this is the visual that our partners have helped us create of what the system has looked like. And then on the right, you'll see the vision for coordinated entry. So the coordinated entry process really has three steps. The first is that assessment of what do people on our streets need, where are they in their mental health, physical health, and substance abuse needs. The second step is assisting them in getting together all of the documents they need, their birth certificates, their housing paperwork, everything that they'll need to move into housing. And then the final step is connecting them with the housing and supportive services, permanent supportive housing, rapid rehousing, or affordable housing, and ensuring that they have the right supports to meet their needs. So just a little bit of background. So coordinated entry is this process by which we will know every homeless individual who's out on our streets or in our shelters, the process by which they're assessed and supported into moving into housing and finding the supports that'll meet their needs. So a few words on why this initiative is so important. First, this is around making sure that everyone on our streets is known and has an accessible path to housing. So what we've heard from the community is, there are many parts of our county where there are strong supports for people who are out on the streets. There are outreach teams covering their region and strong supportive services and permanent housing available to them. There are other parts of our county where that's not the case, where there isn't an outreach team. There's a dearth of housing in that community, and we want to make sure that every part of our county, no matter where a person becomes homeless, they have an equal opportunity to get back into housing and thrive again. The second piece is really around targeting and maximizing the limited housing resources that we have. So how do we ensure that when we do have new supportive housing coming online, that the people who need it most are matched to that housing? Up until now, before we had the more sophisticated assessment tools, we weren't able to connect people or to know what the best housing resource for them was. So organizations understandably would create a wait list and take the folks who came in that met the criteria through their wait list. This assessment now allows us to much more in a much more targeted way to link people to the housing resources that they need. The third piece is that we can streamline the process of moving from street to home. So we know that the process has become already faster and more efficient in navigating the process from moving from the streets into supportive housing or affordable housing. And finally, there is a federal mandate for coordinated assessment from HUD and what we felt as a community that assessment is necessary, but it's not sufficient. That we want to know, certainly do want to know everyone's needs, but we also want a comprehensive way to link them to the right housing resources. So this is a visual, a very rudimentary visual of what this process has looked like so far. So this project has been done, first began as a partnership between Home for Good and our partners at the Rapid Results Institute and Community Solutions, where we've asked them to come in and support Los Angeles in designing what coordinated entry could look like. We've fallen in love with the Rapid Results model, which is a 100-day process to achieve an unthinkable goal. So we thought, what better goal than creating a comprehensive coordinated entry system in Los Angeles County to take on. So the way this is designed is there are design teams on the ground that consist of the people who do this work every day: outreach workers, case managers, housing navigators, support staff from permanent supportive housing sites, as well as some of our public partners who work very closely with those folks on the ground. So direct line staff from the Department of Mental Health, from the VA outreach teams, from the local housing authorities. They've also been a part of the design teams. And those design teams in each SPA have been and will continue to design what coordinated entry looks like in their community, and then to provide feedback as to how it can function as an overall system for the county. So those teams are then supported by policy and systems teams. Policy and systems teams also consist of a few representatives from providers who are doing the work on the ground, as well as many of our policy and systems leaders from the housing authorities of the City and County of LA, from LAHSA, Departments of Mental Health and Health Services at the county, the VA, Corporation for Supportive Housing, and other key partners throughout the community who are asking those design teams, what can we do at the policy level to make the implementation of this system as smooth as possible? So it's everything from looking at regulations that can be challenging at the local or federal level, creating streamlined application processes at our housing authorities. It's a whole host of things, and one of the largest focus areas for those teams has also been harnessing the resources that we need to make the system work. We all know that the housing resources are most critical, so these teams have been looking at how do we increase housing stock so that we have somewhere for people to go once we know what their needs are. And finally, there's a support team that consists of coaches from United Way, the Rapid Results Institute, and Community Solutions. And this team works together to support each of the SPA design teams throughout the county, as well as helping bridge the communication between these design teams and our policy and systems team. So thus far, we've had over 65 nonprofit organizations, providers engaged in this process, and we hope that number will continue to grow every day as more and more providers engage in this work, and all of our major systems partners throughout the county engaged as well. So it's been an incredible process, and it's very much a work in progress. So this is, we have been through about 300 days of planning and testing and implementing, and that process will continue. We'll talk a little bit more about that, but we have appreciated that in this model there is room to pilot and test and then continue to refine the system, and that process will continue over time. We don't see this system as ever being, set in stone, but a continual learning process as we go. So again, for the data nerds in the crowd, we have a little bit more data here. We now have over 3,500 surveys completed, these VI SPDAT assessments, and they have helped us understand what the best housing resources are for people on the ground. So we see that For those surveyed thus far, for about 16% of them, affordable housing is the right fit. Close to half, the best fit is rapid rehousing, and then another 39% permanent supportive housing is the best fit for them. And a little note for those of you who have been engaged in coordinated entry, there are different levels of acuity, and a score of 4 is that highest level of acuity. So this just shows you how that 39% breaks down between those two levels of acuity. So it's pretty rare to find someone who scores a 4, but we know that those are the folks who are the most vulnerable out on our streets and who we want to prioritize for housing as quickly as possible. So communities have been focusing on those 4s and seeing, okay, there are only 263 4s that we know of right now throughout the county. How can we work to prioritize them for housing as quickly as possible? And one more slide of data. This just tells you how the chronic homeless population breaks down, the same set of data, but just focusing on chronic homelessness. They are 78% of those assessed thus far, and there is a note that coordinated entry has been focused on street outreach to the most vulnerable, which is why that percentage is so high. And you'll see that breakdown then among this population is slightly different than the overall population. So a couple notes on coordinated entry. As we've gotten questions, people have asked us, is this system done? What am I required to do for this system, and what's left up to the discretion of the local community? So there are a few things that will be streamlined across the county because our intention is that there not be 8 different coordinated entry systems throughout the county, but one large system that has a local design and implementation. So a few things that are common across the whole county, and that's the common assessment tool, this VI SPDAT, and the use of a database, which right now is a Google platform that Community Solutions has been designing and refining over time. It's been a fantastic tool, and that will ultimately move to HMIS. LAHSA has been looking at how HMIS can serve as a platform for coordinated entry. Another common factor will be common supports and roles. So each community, we're encouraging there to be one SPA-wide coordinator as well as sub-regional coordinators. We know the SPAs are very large and that it would be difficult to coordinate an entire SPA from one organization, so we're encouraging that the community, that the SPA-wide coordinator bring together their whole community, but then that community be broken down into sub-regions that different organizations can take the lead in. We also have common housing applications that have now been created across HACLA and HACOLA. This happened during the first 100-day pilot that began in Skid Row. The design team was saying very clearly, the work group that was designing coordinated entry for Skid Row said very clearly one of the major challenges was the different housing applications at these 2 housing authorities. And the housing authorities worked very quickly to create a streamlined application called the RUSH application. And finally, the last pieces that are streamlined across the county are both the lease up for countywide resources, like those resources through the Department of Mental Health or other countywide systems, the VA, Department of Health Services, and prioritizing the most acute individuals for the next available local housing. That is one thing that will be streamlined as well, that will be encouraging communities to serve the people who are most vulnerable in their next available housing units. And then there are a whole host of things that SPAs are invited to design at the local level. And we'll talk a little bit soon about the RFP that's come out to support communities in doing this. But basically, these are the factors that each SPA can design locally. So the governance structure, both SPA-wide and then in the local sub-regions, how does each SPA want to coordinate that governance structure? That's completely up to the SPA. What are the access points for people who are homeless in the community? How will that community ensure comprehensive outreach coverage? What does that transition process look like for clients through outreach, navigation, housing, and retention, if any? or will that be streamlined through one provider for each person? And then supplemental documents or questions for that community can absolutely be tailored at the local level. So that's just a very brief overview of coordinated entry. We hope for those of you on the call who are not yet engaged in coordinated entry, we encourage you to join your SPA's coordinated entry team. For those of you who are interested in volunteer opportunities, there's a great opportunity to support these local teams in doing assessments of folks who are homeless within that community. So you can go to our website to volunteer for that. And everything you could possibly want to know about coordinated entry is on our coordinated entry website, so you can use that link below. If you have more questions, you want to find out who your local team is, how you can get engaged, more about coordinated entry, please visit that website. And you can also talk to, on our team, Chris Coe and Joanna Bomba are the staff who have been leading this project and doing a beautiful job in working with people across the community. Also, Leslie Wise from Community Solutions has been a fantastic coach to communities on the ground and a key partner in designing and implementing. So I know she is also happy to be a resource as it's needed. All right, so second initiative, Funders Collaborative. So our Home for Good Funders Collaborative is our partnership of public and private funders who are working together to align resources for supportive housing for chronically homeless people. We started this about 2.5 years ago with the realization that we had tremendous resources in this community. Certainly, not everything we need, but through our analysis, we realized there are $875 million each year in public resources spent on homelessness, and we remain the homeless capital of the nation. So we saw that as a tremendous opportunity to bring resource holders to the table to say, how can we leverage one another's investments to make the biggest impact possible? We were also hearing from providers that it was cumbersome and frustrating to have to apply to sometimes dozens of different funders to make a project whole. So we also wanted to streamline funding applications for providers and ultimately draw in additional resources through opportunities for leverage. So presenting this collaborative as a table that funders could come to where they didn't have to have the entire solution. Their funding didn't have to do it all. They could invest in one piece of this and partner with other funders around the table to meet the need in their community. So we have an amazing group of funders who are around this table. You'll see the long list here. We're incredibly grateful to the Conrad N. Hilton Foundation, who gave us the initial challenge grant to get this collaborative off the ground. And all of the funders that you see here, just an incredible group of people that not only are investing their funds, but are helping design the request for proposals that go out each year, and then together looking at how we can layer and leverage our funding to best support the work that's happening on the ground. So you'll see a number of cities throughout the county have been involved, great partners at the housing authorities at the city and county, our county departments, the VA, just so many incredible partners have come together around this on both the public and private side. So we're incredibly grateful to that group for coming together. Right now, for our Funders Collaborative, we have a request for proposal that is live right now. It was released on March 6th, and a major part of this RFP is the coordinated entry design and implementation portion. And this, we really do want to emphasize the flexibility of this portion of the RFP. So communities can apply for funds to both design the local implementation of their coordinated entry system and or the implementation of that system. We know right now each SPA is in a very different place in terms of their planning around coordinated entry, so we wanted to be very flexible in meeting those needs. So we encourage you to take a look at that RFP. It does call for one lead agency within each SPA, but we're looking for a robust partnership of organizations within the SPA who will work with that lead agency on design and or implementation locally. There are also several other aspects of that RFP which we encourage you to take a look at for those of you who are providers. We have a housing innovations portion of the RFP led by a California Community Foundation, a Moving On initiative through Corporation for Supportive Housing, and then a number of opportunities for renewals for existing grantees. Finally, we have two great opportunities through our public partners. There's the HACLA and HSID Permanent Supportive Housing NOFA for new development, and the Department of Mental Health PATH RFP. So you can locate those through our RFP, and those will link to their sites for more information. So these proposals are due April 18th, with the exception of the last two RFPs. Those have separate deadlines, and the grant period will begin July 1st. So you can go to our website. There's the link down there for more information on the RFP. We've just finished up a round of informational sessions in each SPA, but there are many opportunities to ask questions. We will have another webinar for more information. You'll see a frequently asked questions on our website, and you're always welcome to reach out directly to us as well with specific questions. You can email us on our RFP email line, or you can also reach out to our staff who focus on this project, Zahira Mann and Joanna Bomba, who will be leading this RFP process. So we encourage you to reach out and find out more about this. All right, and finally, we have our standards of excellence, and this is a project to look at what are the common outcome and operating standards that really define excellence for outreach and housing navigation, for emergency shelter and bridge housing, and permanent supportive housing. And this is a project led by Mike Nailat on our team, and working very closely with our partners at the Corporation for Supportive Housing and Shelter Partnership to bring the community of both providers and funders together to ask that question of what does excellence look like. So a few reasons why this project came about. The first piece is around really looking at how do we focus both our funding and the time and energy of our providers to be clear about the outcomes that are most important to us. We had been hearing, just as a funder ourselves, we had been hearing from providers that we were often making this more complicated by incentivizing a multiplicity of goals. So how could we come together as funders to agree on the most critical outcomes with lots of input and feedback from providers on what those should be? We also wanted to align with federal funding streams and best practices to ensure that we as a community were both aligned with those best practices and also as competitive as possible for federal funding. Next steps on standards of excellence. The standards have been in the design phase for the last couple years, together with dozens of partners and providers and funders throughout the community. So this spring, for the next several months, we'll be piloting the assessment tools to look at how do we now measure for these different standards. We'll also be gathering countywide data on where are we now as a region on all of these outcomes, not just at the provider level, but across the community. And then this summer, we'll begin to look at what is the design of the certification that might come out of this? How can we highlight providers that are achieving that level of excellence, and how do we create the best assessment process and determine what a launch will look like? So we will be continuing to work with the community on that process. You can check out the latest edition of the Standards of Excellence at that link below, and reach out to Mike Nailat on our team if you'd like to be more involved in this project. So a few different opportunities to engage, just to summarize where we've been on the slides that we've run through. So for providers, again, strongly encourage you to get involved in your SPA's team for coordinated entry. We're excited to see this opportunity for SPAs to really come together and providers across each SPA to work together to design this system and ultimately to implement it across their SPA. We also hope you'll take a look at the Funders Collaborative RFP and consider applying for one or more of the funding opportunities there. And the third piece is that piece that we talked about around the gap analysis. So consider dedicating 100% of your supportive housing to chronically homeless people, and of course tailoring that to the resources that you have within your organization, and whether that be a focus on mental health, physical health. The coordinated entry system ultimately enables you to really target those units to the people that are the best fit for the resources you have. So that's one challenge that we will put out to the provider community, and know that we want to support you then on the funding side as well, to ensure that you have the services and supports you need to really help people thrive once they're in housing. To our public and private funders who are with us, if you're not yet a part of the Home for Good Funders Collaborative, we encourage you to join that table and invest your resources in this collaborative. It's a tremendous opportunity to leverage the resources we have. This year we're looking at $6.6 million in private resources and likely over $120 million in public resources. So there are tremendous opportunities there for leverage. And we're also strongly encouraging funders to dedicate their resources to coordinated entry so that we can support these SPA-level teams in getting these systems off the ground. And for any community members that are on the call today, we have lots of opportunities for you to give, to advocate, to volunteer, to really be a part of this effort across Los Angeles County. You can get involved in your local community to really make a difference on this. A few more opportunities here. We have free social media trainings for our providers. You can find out more on that link. Again, we have a volunteer training for anyone in the community who wants to support conducting assessments of people who are homeless in your community. And we'll also be having community screenings of the At Home documentary that features Mark Horvath. So for all of this engagement work is all led by Emily Bradley on our team. So if you have questions about any of this, you can reach out to her. Starting in the fall, we will be continuing this webinar series on the second Thursday of every month. That'll start in July. We'll also have countywide capacity building sessions for providers starting in the early fall. So this will be a continuation of the technical assistance we were providing through Standards of Excellence. So right now we're shaping and tailoring what those opportunities will look like. So we encourage you to reach out to Emily Bradley if you have ideas for what those sessions, where you'd like to see those sessions focus. Please do let us know. We'd love to know how we can be the best support through those sessions. And finally, save the date for Home Walk. We know it's over 6 months away, but we're already thinking about it and planning. This year's Home Walk will be on November 15th, which is a Saturday down at Expo Park. All right, so with that, we have about 10 minutes to open up for any questions or comments that you all have. You can submit them via chat or let us know via chat that you'd like to ask a question, and we can unmute your line. Again, you are all muted right now just for the purposes of background noise and hold music that we often experience on these webinars, but please chat in if you have any questions or comments on what we've covered so far. Really, no questions at all? Comments? Here we go. Okay. Okay, so we got a question through the chat. Is there a place for legal services providers to partner with others on Home for Good grant initiatives? Absolutely. So for legal services providers, the best opportunity right in this moment would be to connect with your local coordinated entry team. So we'll publish this webinar, this set of slides, both the audio and the PowerPoint online if you missed any of those links throughout the PowerPoint. But we encourage you to connect with your local CES team, as we know legal services providers can play a great role in this work, both on the eviction prevention side, benefits enrollments, So depending on where your organization focuses, I imagine that the local CES team would love to partner with you. Great question. Great, and we had a question about the coaching for coordinated entry. So a clarifying question around the coaching for coordinated entry that United Way will provide is in addition to the funding they may receive. It's a great question. So yes, the coordinated entry teams are, in each SPA can apply for planning funds for the next year, as well as implementation. And all of the coaching supports that the teams will receive through Community Solutions and United Way will all be in addition to that. So that coaching will occur over the next few months, as well as throughout the grant period over the next year. Great. Great. And another question here on chat. Is there a way to connect with those interested in building supportive housing units? Yes. So Brian, I'm going to unmute you and ask you if you could say a little bit more about that, because I want to make sure I understand the question. So you are now unmuted.
Greetings.
Hello.
Basically, I'm looking to partner with agencies that are looking to apply for that RFP for new supportive units or currently units that are existing.
Great. And what does your organization do? What's the focus of your organization?
Temporary supportive housing. So we transition clients in emergency, and we partner with local agencies in our SPA, the Department of Mental Health, homeless health care.
Fantastic. So
we have all of the components are there, but we just want to know if there's any other, overheading, overall agencies that would be the lead agency rather for this type of.
Great.
RFP.
That's a great question. So for the coordinated entry portion of the RFP, you can start by going to the coordinated entry website that was, the link was up earlier in the webinar. That will show you the current lead within each SPA.
Okay.
I would encourage you to reach out to them, and they will likely know the process that SPA is going through to determine a lead agency. So through this RFP, again, there will be one lead agency in each SPA, and then a number of sub-grantees and other partners who will be working together on this implementation.
Okay.
So I believe Emily is putting that link into chat right now, so you have that easily accessible. And if you have any challenges in getting in touch with them, please do let us know. You can reach out to Chris Coe or Joanna Bomba on our team. And their email addresses will be available in the next slide if you're having a tough time connecting with the lead there.
Excellent. Thank you.
Great. Thank you. All right. We have a couple more minutes if there are other questions. I'm going to scroll up and see if I missed any on chat. Okay, I will go to the next slide, but you'll still have a couple minutes. All right, so a couple ways to stay in touch with us. You'll see our website, homeforgoodla.org. It is currently under construction, so be patient with us as we join the 21st century of technology and create an even stronger website. You can also find us on Facebook and Twitter, Home for Good LA on Facebook, and at Home for Good on Twitter. And finally, wanted to share with you all, I think many of you on the call who I work with have seen me growing over the last 9 months or so. So I am headed out on maternity leave early next week. I will be out April through June and returning in early July. And in the meantime, we have an amazing team of people on the Home for Good team who can be your point person on any of these initiatives. So coordinated entry, as I mentioned, Chris Coe. our funders collaborative, Zahira Mann. If you have questions on our collaborative RFP, Joanna Bomba is your point person. She's also a great support on the coordinated entry team as well. Mike Nailat for questions on the standards or any of our data work, any of the gap analysis that you saw in the earlier slides. Emily Bradley takes the lead on all of our partner engagement. And for any general inquiries, Tina Estedabadi can answer general questions or link you to the right person if this list doesn't summarize every possible question you might have. So I will say I will miss seeing you all on a regular basis, but very excited about what's ahead, and I really look forward to reconnecting with